Once again, we'd like to welcome you to today's edition of The Morning Call. Uganda's cabinet approved on Tuesday a national health insurance scheme bill that is meant to improve the provision and access of health services to all Ugandans. This is according to the country's Commissioner for Planning, Financing and Policy in the Health Ministry, Sarah Byakika. According to her, the scheme will ensure that residents have access to equitable, affordable and quality health care services. If the bill is approved, it will be mandatory for every Ugandan above 18 years to pay for the national health insurance. Civil servants and formerly employed Ugandans will be required to contribute 4% of their gross salary to the scheme. Uganda will be the last East African country to adopt a national health insurance scheme. Ruth?
And the
government also hopes that through this scheme, it will be able to mobilize funds to subsidize the cost of provision of healthcare services to the population and the indigents in particular, and be in a position to promote social protection by protecting households from catastrophic health expenditures.
Well, to talk about this health insurance scheme bill is Joy Asasira, a social rights activist in Uganda. Joy, it's a very good pleasure. It's a pleasure to have you in the program today. So the first question that we have for you, how would the national health insurance scheme work for Ugandans in terms of access and even in terms of the structures available in the country?
So definitely, because, our health sector is underfunded as a start. So staffing is poor, motivation, remuneration for health workers is also very poor. But also most, in the public health facilities, some of the health services are not available because of implications and the number of people that require those health services. Basic things like maternal health care, where even when we know that cost sharing was scrapped in our country, many women are expected to come to the health facility with a mama kit, which is basically just a kit that is the very basic maternal health commodities, the gloves, sutures, and gauze and plasters and etc. So and many of these even actually are not able to even afford these basic, amenities in the first place. So to have a national health insurance scheme that guarantees that regardless of someone's economic standing or social class, that they are able to go into a health facility and access, health services would be, a life-changing, situation. And particularly also when you think about the fact that many women, many children especially, are dying from preventable causes or things that can be treated and managed, but are unable to be saved because, the health facilities just cannot afford to, provide this care. So it could be, life-changing for many Ugandans to have this scheme in place.
But Uganda doesn't have a good report in terms of corruption. It has even failed to manage drugs in government facilities. So how will this universal health insurance be sustained?
Yes, so definitely the planning and setup and, the way the scheme would be set up would be in such a way that it should be managed within maybe an entity that is already existing and has proven that it has a good track record in managing public funds. Some people have wanted the National Social Security Fund to be the holder of these funds, and then working with the relevant sector in terms of health and others to ensure that these funds get to where they need to go. But I want to think that it's not just the corruption, but rather the need for political will, that there needs to be investment on part of the government in terms of ensuring that the funds that are required in the first place are made available, and that they are made available on time. And obviously we know that even when it's a national health insurance scheme, some people will have to pay. Those who can afford will have to pay. But most of the people cannot access services as those who cannot pay. So the government has to make a commitment to be able to pay for people like indigents and young children, those who are orphans, those who don't have, parents to take care of them, or whose parents are either mentally incapacitated or in prison. So for me, corruption, yes, is a problem. It can be managed if the way the scheme is set up is in such a way that there are checks and balances, because we know that there are so many other schemes. You know, the Social Security Fund, for instance, is one example of a scheme that has worked and is working.
We have to leave it at that, Joy, but many thanks indeed for your insights regarding this situation. Joy Asosira, a social rights activist in Uganda, speaking to us from the capital, Kampala.